Good morning. I want to thank the sheriff, our EMA director, and Dr. Goggins for joining us once again for our weekly update that we want to provide our citizens and certainly help give guidance and provide some clarity around what the governor has given us. We just got off a call with 21 other leaders from across the state who were on a call with the governor in light of where we are, and most importantly, his executive order. So give me just 1 second here. I normally wouldn't have walked out with a host of other papers in my hand like this, but in the change in circumstances, we find ourselves at a place that we've never been. And so, to that end, again, let me begin my comments with the following. Good morning. Generally, Augustans across our community are doing what we're asking them to do. As I shared just a few days ago with regards to the announcement that we will be reopening the state of Georgia, that we certainly do not want to undo much of what progress has been made already. The COVID-19 healthcare crisis is irrespective of a person's political party, their race, ethnicity, or gender. And to that end, I think it's important for us to provide our citizens with an update in terms of what we know and understand from the governor's order. As of 3:41 p.m. on the 20th of April, the governor provided an executive order that would open up parts of the state of Georgia's businesses beginning on Friday. In that order, it will go until the 13th of May, or it's terminated. The governor mentioned in his press conference that they would allow restaurants to reopen for dine-in service starting on Monday, April the 27th. And in his executive order, he did not give guidance, nor was it addressed in terms of what that would look like. On the call that I just got off of, he did indicate that guidance would be sent out here shortly with directions about how that would proceed. What I want to share this morning are the things that we know that are imminent and are going to happen. In the governor's executive order, beginning Friday, April the 24th, gyms, fitness centers, bowling alleys, tattoo piercing parlors, commercial and in-home hair and nail salons, or schools, aestheticians, hair designers, and massage therapists may move from no operations at all under the April 2nd shelter-in-place order to minimum basic operations, including the 20 precautionary steps that were provided by the governor. This would allow them to provide services, but would have to include reduced capacity. So for those Augusta businesses that are intending to open on Friday, you will have to do that under reduced capacity. That includes social distancing, enhanced sanitation, staggered employee shifts, and other precautions. It leaves in place the terms in the April 2nd order closing theaters, live performances, venues, amusement ride operators, and bars. I want to reiterate that bars, places of live performance venues, amusement ride operators, and theaters will in fact remain closed. They are not opening under the governor's executive order. What's equally important for us to understand is that as we move into this phase, it's important for us in Augusta to give local guidance about what that can and should look like. I think it's extremely important for us and for those of you who are employers and businesses to consider the following: to focus on the guidance that was given from the Trump administration, from the White House, concerning what reopening looked like from their Phase 1 guidelines. And in those Phase 1 guidelines, they encourage churches to remain closed for in-person worship. I know that out of an abundance of caution, many of our religious institutions and houses of worship are considering what their next steps are, but I would encourage you to follow the Phase 1 guidelines that were provided to us from the White House that encourage these businesses to remain closed in phase one. Churches, theaters, sporting venues, and public venues that have large capacity. Again, that's extremely important. In Georgia, we saw that the first places of outbreaks were funerals and religious institutions. I would also encourage our businesses who are considering reopen that they maintain the guidelines related to safe social distancing, that you require your employees to wear appropriate PPE, and that you consider reduced capacity and, where appropriate, put markings in your places of business that would allow individuals to follow the social distance guidelines of 6 feet or more. In terms of enforcement, the governor in the call today anticipates providing additional guidance that I will believe will come through other executive orders over the next day, if not this afternoon, that would allow local government law enforcement officers to continue to have the ability to cite those businesses that are not in compliance. Our sheriff has already been diligent about supporting the governor's executive order, and will continue to do so moving forward, along with our EMA director. The governor's executive order still, all Augustans, hear me when I say this, there is still a shelter-in-place order until April the 30th. That order remains per day except for essential travel and other limited exceptions. During this phase one reopening, the easing or relaxing of restrictions only apply to those businesses that I just mentioned. The shelter in place continues to remain in place again until April the 30th. If you have no reason to leave your home absent for going to seek medical care, prescription medications, grocery shopping, and or essential business pursuant to the Department of Homeland Security's guidelines and the CDC's guidelines, you're encouraged to remain in your home. Over the last few days, I think all of us across the state of Georgia, and particularly those of us who are local elected leaders, while we may have been surprised and concerned, what I know in Augusta is that we continue to need more rapid and available testing, contact tracing, and treatment. Today, there is no vaccine. There's no cure for coronavirus. And to that end, as the mayor of the city of Augusta, I'm encouraging our residents to continue to practice the guidelines provided to us by the CDC, to continue to safely social distance, and to remain in your home out of an abundance of caution as we continue to work towards flattening the curve. We cannot do that if we all resume what we believe to be the normalcy of life and going back to doing things the way we've always done them. We will continue to see a spread, an increase in confirmed positive cases, and likely death that will take place if we do not flatten the curve and stop the spread of the virus. At this point, I'm going to pause my comments and ask our sheriff to come forward.
Thank you, Mr. Mayor. Thank you all for coming. First, I will cover the recent COVID-19 cases at our detention center, and then our continued law enforcement response during this current pandemic. As you all are aware that we have 2 confirmed positive COVID-19 cases in the last 3 days at the Charles B. Webster Detention Center. One being a contract medical worker, and the other being a deputy jailer. Both are currently at home under quarantine. With the assistance of our EMA division and as a precaution, the employees at the Richmond County, at the Charles B. Webster Detention Center, and civilian contractors are in the process of being tested for COVID-19 at various drive-through locations operated by the Department of Health. We also are receiving assistance from AU Medical Center and the Georgia National Guard with arranging for testing of inmates who had direct contact with the healthcare provider. We have implemented additional safety protocols at the detention center to help reduce the risk of further exposure. With the assistance of Chief James and his office, we were able to locate cloth masks designed to be used in a correctional setting to distribute to all of our inmates. Working with Ms. Sams in the procurement department, we were able to make an emergency purchase and hope to have those masks here by the end of this week. This remains a fluid situation, and we hope to continue to update you as the situation develops. As it relates to the governor's order, as the mayor said, we are still charged with the enforcement of the shelter-in-place order until it is expired or extended on April 30th. We're still having issues primarily with large crowds that are gathering in social events and areas. Our public and our citizens have done an outstanding job when it comes to the fact of reducing travel, social distancing, and not going out unless for essential services. And I want to applaud them for that. However, as the mayor said, we have come too far to now, with the new orders being in place, thinking that this is going back to life as normal. So we will still enforce the social distancing guidelines within businesses. We will still enforce the gathering of crowds of more than 10 or more. We are still highly in the educational phase, but as the mayor said, in abundance of protecting life and the citizens of Richmond County, we're going to take a much harder approach moving forward. And this also will be based on the guidelines given by the governor that are pending. And I say that for this particular reason. In Richmond County, within our government, within our law enforcement and first responders agencies, especially with the sheriff's office, we have been extremely fortunate with the number of cases that we have had based on the number of calls for service. We are the largest and the busiest law enforcement office in this area. And yet we've only had the 2 cases, one being a contract worker and one, again, being a sworn deputy. That is a blessing to this county. To give you the magnitude of that, if our agency was infected at the rate that one of our local partners, neighboring partners, was that 25% of their force was affected by the coronavirus, that would be over 104 deputies that wouldn't be able to be on the street. So each time we have to go out and expose the deputies to the social distancing, people who are violating the order, it is putting those assets at risk. And that is for all first responders, that's for all citizens of Augusta. So imagine that's 104 deputies not on the street for a minimum of 15 days. Think about if you miss a firefighter, that's one firefighter who is not on the streets of Augusta for a minimum of 15 days. If the virus spreads because we're having contact with our other MA and the 911 personnel, that is one 911 dispatcher who cannot be on the other end of that telephone call when you're in need of service for at least 15 days. And even to the central workers within the sheriff's office, if we have a records clerk who is infected, that's 15 days that you can't process that insurance claim and that paperwork that you need in order to process your daily activities. So please look at the magnitude of these resources that you will be taking from the community if we do not shelter in place. We look forward to the additional guidelines given by the governor. As I stated before, we have done an outstanding job thus far, and we do not want to have to start over. We have been working together as a community partners with all local government, and the city of Augusta should be proud of the progress that we've made and how we work together. And as always, when we continue to do so, we will get through this, but we will only get through this if we work and continue to stay together. Thank you.
to provide a couple of updates on two key priority areas for public health, those being testing and contact tracing. So in terms of testing, the governor's order did include information about that. We're now bringing additional resources into the statewide testing efforts through Augusta University and the National Guard. Augusta University's telehealth screening system and its app will be available statewide as a way to access some of the drive-through testing sites that are across the state. And also the National Guard is going to be assisting with those and with a strike team that can provide large-scale testing for long-term care facilities or other institutions where there might be a need for large numbers of tests to be done. Overall, our goal is to increase the number of tests available as much as the resource limitations on supplies, et cetera, will allow them to be. Tests are important for both the individuals involved in their management as well as for the policymakers who will use that information to make policy decisions. One thing about testing that is particularly local, we have partnered with the Housing Authority and also Christ Community, the federally qualified health center, to try to offer testing in places where we feel like individuals may not have transportation or may have other difficulties accessing testing resources. So yesterday, a team went to one of the buildings that Augusta Housing manages with a large number of folks at high risk for severe COVID-19. 125 people approximately were tested, and the model worked very well, and we intend to move that now to different facilities that are part of the Augusta housing system and then to other facilities as well. And then secondly, on contact tracing. So the thing I wanted to stress about that is that we are currently doing contact tracing, case investigations on every single COVID-19 positive person. And the good news is that public health has been doing contact tracing for 100 years. We actually have over 70 reportable illnesses in Georgia, and for each case of those that happen in the state, we do a case investigation and also deal with contacts as needed. So we know how to do this successfully. The issue with COVID-19 is just the volume. We have already ramped up and we're handling the volume we have now successfully, and we're ready for any increases that may come from the increased testing that we anticipate. One of the key areas there is long-term care facilities. We have partnered with the EMA, and I think Chief James may mention a different aspect to this, but for nursing homes, we are using a team to interview those, call those facilities twice a week to try to get them resources they may need, to help get testing if they need it, to answer questions about infection control procedures, so that we can keep a close eye on that population and any cases that may happen there. The other last thing I want to mention about contact tracing is that we will still need cooperation from the community for this to be successful. The whole point of contact tracing and case investigation is to give information and recommendations to people who are either testing positive or who've been exposed. So when a contact tracer calls someone, they will make a recommendation for quarantining or for other things a person can do to avoid or limit the chance of further spread of coronavirus. And we will need all the folks that we talk to really take those recommendations seriously and to follow through with them. That's what it's going to take for this effort to be successful in interrupting any further spread as we find cases. Thank you.
Good morning. As of 7 p.m. last night, Richmond County had 294 cases of COVID-19. In addition to that, just this morning, we're continuing to have weekly meetings with all of the hospitals. So we conference and meet with all of the hospitals once a week. We continued that this morning to hear their issues to hear what resources they may need as we work our way through this COVID-19 event. The hospital stated this morning that they're still comfortable at this present time with what PPE they still have for all of their personnel and for their patients. What the hospitals are doing now, and one of the things that they are concerned about, as well as us as a government, as the restrictions are starting to be released, we will be closely monitoring what the effect of that will be on our community. Will the cases, continue to go up at a more rapid pace than they've already, or not? So, as the releasing of people being able to move around a little bit more, we do want you to know that we'll be evaluating that very closely, along with the hospitals, along with all of the medical resources that we have, because we have to manage our resources with the number of cases that come up to assure that we have enough resources to take care of our citizens. And that was one of the things that the hospitals were concerned about, is will the release cause a second wave? And we'll be monitoring that very closely, so when we speak again, we will be able to hopefully update you or not on what the effect has been, or if there has been an effect at all. As Dr. Goggins mentioned to you, one of the things that we've done this past week, and we'll do every week, the health department, Department of Public Health, is reaching out to the long-term care facilities, the nursing homes. One of the things that we know we have a lot of in Richmond County are personal care homes. So one of the things that we have started doing is staff has started calling each personal care home that we have contact information for to assure, do they have PPEs? Do they have anyone sick? Is there any resource needs that we need to try to work to get to the personal care homes as well? Even though they are private entities, there are still citizens that live in those facilities, and we need to assure that we take care of them the best we can. In closing, as we open, as business start to open, we encourage our public to be very cautious. As you've heard the mayor, the sheriff, and Dr. Goggins, if you don't need to travel, please, we would ask that you continue to stay home. While they are opening businesses for the economic effect, we are truly concerned about the safety. And as we know that in the CSRA, just not on the Georgia side, but in the CSRA as a whole, our numbers have continued to increase. And so as people have more freedom to move around, we are definitely concerned. We'll be monitoring, and we will ask the citizens to, if you don't need to go out, stay at home. Please stay at home. If you need to go get your essentials, go to the stores, get your essentials, and then come back home. Practice social distancing. Wear your mask. If you have your mask, make sure you wear your mask, and be very careful about what you're touching, keeping your hands out of your face. It's just very important as we try to get to flattening out or getting to a curve. And as we open up in the midst of what we're experiencing now, it will be a challenge to us as a community, and we just need to be disciplined enough to address those challenges. And finally, I will say that so far through this event, and have worked several emergency events in the past, I will say that your government, your law enforcement, your procurement department, with your EMA department, our mayor's office, and any other departments have really truly worked together great. Your government has taken this very seriously and has very much worked as a team to keep our citizens safe. This is not a storm where you can see the tree laying down. This is something that's invisible. Unless you see someone with those symptoms, it's hard to gauge it, and we have worked together well in trying to get resources to everyone, get resources to the public where they're needed, and to educate. And I think in this upcoming week, one of our focuses will be, and you will see it through our public information officers and other folks as they reach out to the media and others, is as we open up society, what will be key is education, and teaching the public, informing the public, stay at home, keeping your hands out of your face, washing your hands, using masks. Education will be key, and then therefore the citizens' behavior after that, and us successfully flattening this out and being able to move forward. Thank you.
We'll take a few questions. Chief James has done a great job of reiterating those things that are important, and I want to take a moment to close with these comments, absent questions, and that is to our fellow Augustans. If you are part of that vulnerable population, that you should continue to shelter in place consistent with the governor's order, and that members of your households where there are vulnerable individuals, you should be aware that when you return to work or any other environments where distancing is not practical, that you could carry the virus back home. Every precaution needs to be taken right now, and we cannot go back to what we thought was normal. We've got to take these grave measures, even as we see parts of our business community opening back up, because it is vitally important for the safety of life. Precautions should be taken to isolate from vulnerable residents in your homes. For individuals, as the sheriff has mentioned, we have had great support from members of our community, but we know that there are still some who are just bent on congregating in large numbers. I want to reiterate what our sheriff has indicated, that as individuals, when you're in the public, whether you're at parks, outdoor recreation areas, or shopping centers, you should maximize physical distance from others. Where there are social settings of more than 10 people, if you cannot practice safe social distancing, I would encourage you to take precautionary measures and not be a part of those settings. Avoid socializing in groups of 10 or more, and if circumstances do not allow you to readily provide for safe social distancing, again, I encourage you to not be a part of those events. Minimizing its travel, unless it's essential travel, stay at home in concert with the governor's executive order from April the 2nd. As it relates to our businesses that are in fact reopening, I would also encourage you to telework. We're doing it in the city of Augusta in unprecedented numbers, where we have individuals that can in fact telework from home, and when it's possible and feasible to continue business operations, allow teleworking to take place. And if you're returning to work, our employees, our business community, do so in phases. Don't bring everybody back at the same time. These are just basic guidance from our White House administration, from the CDC. And if we do these things, we can continue to flatten the curve and stop the incline in the spread of the virus in the city of Augusta. That is what's important to us as we have come to bring an update to you here in the community, and it will continue to be important over the next several days as we see other industries opening back up and returning back to work. And with that, we'll take some questions. Troy?
Quick question. When you were talking about reduced capacity, that seems somewhat subjective and a little vague to me. I mean, how are we going to maintain 6 feet in a hair salon when I got to be, on top of the client? Likewise with the fingernail place. How are we going to manage this, and how do these numbers work out? Who determines that they're in violation or not?
Well, I think, again, as I said earlier, we're expecting the governor to provide a set of guidelines that we're hopefully going to be able to transmit across our community. And I think that holds true in all 159 counties in the great state of Georgia. We need those guidelines because otherwise people are going to go back to doing what they're comfortable with. They're going to go back to doing what they've always done in order to meet the needs of their customers. And so from an Augusta perspective, what I would encourage our businesses to do, particularly our barbers, our hair salons, our stylists, and our nail salons, is to go to the CDC's website and take those guidelines and begin implementing them before you bring customers back into your place of business. Put lines in place, move your hair booths 6 feet apart, and for those of you who are meeting the needs of a client, a customer, that you should wear a mask. Encourage your clients, your customers to come in with a mask and have those things. Stagger your customers. Take appointments when necessary, but certainly in your places of business, try not to have more than 10 people at one time, particularly those places that are community-oriented in nature, like barbershops, hair salons, nail stylists. These are the things that I would encourage, absent, again, any guidance today, that they would do those things.
And Sheriff, to follow up on that, you'll be the one who's gonna have to go out, or your men will have to be the ones checking these places, I assume, to see how they're doing, if they're following instructions. What can you do? What are the penalties for having 8 people getting their nails done at a single time, or 10 people getting haircuts in a single barber shop?
Well, right now, that's why we say, right now, we're definitely in the education phase. From the onset, when the governor entrusted us to enforce his order, they encouraged us to provide warnings first. So now, as the business is opening up, our first response is going to be warning of what we think they can do, in fact, to become more proficient. Like you said, as you can tell, I haven't seen my barber in a while. He's been calling me, but I don't plan to go back in the near future until we can get past this era. But again, in the shop in which I go to, several times there are always people waiting that you may be 3 or 4. That has to stop. They have to manage that clientele. And our purpose is to go in and educate them on that and say, look, this is what we suggest that you do, and this is in accordance to the guidelines. Now again, if the governor gives additional orders, we'll go by them. But right now, we're hoping that these businesses that are now just reopening are going to follow those guidelines. And if they're unfamiliar with them, that they're not doing any malice in it, that we can come in and educate them and say, look, I know you think this is okay, but it is not. You need to do this. And I'm sure from what we've gotten in the past, most businesses have compliance. We've only had one problem industry that we had a problem that the socialists, and we were able to go in after a couple of sessions with them and correct that. So we've only seen one problem that we've had to address more than once. So we hopefully that will continue.
So mayors across the state, and even yourself, Mayor Davis, have gone and expressed concern even on Monday on national TV about the decision of Governor Kemp to open the business up Friday and Monday. Did you express those concerns this morning to the governor? When did he respond? Did he address those concerns with you?
Well, the governor, again, as I said, I'm pleased to be a part of a group of municipal leaders that the governor selected to provide guidance during this process on an advisory committee for the governor. I've enjoyed a great relationship with our governor, and we've been friends for a long time. Again, absent the surprise, this is where we are today. In the call this morning, the governor's intent was to provide us with one. I understand that there are some that are happy with what I did, some that are not so. He fully understands that. He's received encouragement, he's received complaints. The governor understands that. This is the state of play and the nature of business that we find ourselves in. While also understanding that, the governor knows that this has to be measured. He indicated that as much yesterday in subsequent interviews that he's conducted, and of course this morning as well, that this has to be a measured approach, and we've got to take all of the necessary precautions in order to be successful in this, lest we find ourselves in a relapse state or a second wave of this coming now, as opposed to possibly in the winter. And so to that end, what the governor indicated is that we're going to see a relaxing in terms of giving the locals an opportunity to do more of the enforcement, which I think is critical. We are on the front lines of government, and we're the closest to the people at the local level. The sheriff and his team and our EMA director have done a phenomenal job of working with the community. As they both have indicated, this is one of the finest hours that we've seen in terms of the collaboration and working together to make sure we keep people safe. To that end, Joseph, what we're seeing right now is that the governor has indicated today that in these next series of orders and or guidelines that he's going to provide, it will be clear in terms of the enforcement mechanism. As the sheriff indicated, we'll continue first with a warning. Then there's a potential of the $1,000 fine, and absent compliance, your business will be shut down. That's what's going to happen.
How does this impact the homeless initiative? We had several hotels that reached out to the city saying they wanted to be involved. Is that now dead in the water?
No, it's not. We're continuing to meet the needs of our homeless population. Absent some of the early missteps in that conversation, we know that there are a number of partners who have already stepped up. We continue to service the needs of families that are homeless, in particular those that are large in number. And so I want to make it clear that we're continuing to address the issues of homelessness in our city during this pandemic, and we will continue to do that even as we see parts of our economic industry moving forward and opening back up.
Aside from the business industry, you said that, Sheriff, we're still having issues with large crowds. And I know that we're waiting on further guidelines from the governor, but how exactly do you plan to have a much harder enforcement response? I know that the mayor just said $1,000 fines for businesses and shutting them down, but what about for individuals?
Yeah, we already had, like I said last week, the advantage of writing a citation if so needed. So what we're doing now is we're monitoring the locations, and what we're doing now, we have to go back to the location multiple times, and that is when we're going to actually start documenting the individuals, because right now what we're doing is going to these locations, trying to educate the groups as a crowd. And now what we'll do is we're seeing repeat offenders, we will now start individually identifying these individuals, keeping a track sheet of that, and then if it persists with the same individuals, then we might take a more broader approach to it. So right now, the 10 or more still stays in place, so we're not going to change that at all. It's just the documentation of multiple locations is now going into effect.
I have a question for the doctor. In terms of cases, I know a lot of people talk about the peak of the curve. Now, have we reached that peak here in Augusta, in the state of Georgia? And how is that curve looking in terms of cases?
So you may be familiar with some of the modeling that people have followed, and there's one in particular that a lot of folks have consulted, and it has changed recently to pull the Georgia peak back from where it was originally placed. So the modeling is, I guess, at this point not stable because we don't have all the information that we would want. But just from a practical standpoint, because we're increasing testing still very steadily, then I think we're going to anticipate that we'll see increased case numbers. Just as a function of the fact that the tests are going up, and they're going up across the state. So, and because we are putting a lot of emphasis in testing in vulnerable populations, where we might anticipate that we would see cases as well. So, as far as the underlying reality, the models are not consistent, but as far as what we probably will see, just because of our testing efforts, I think we will see case numbers continue to rise for the next several weeks at least.
So if the models aren't stable, how will you measure when a second wave could likely come? Like, would we be able to say, oh, June, we expected the cases to go down, but now we're seeing more cases, so we've actually hit a second wave?
I think it's going to have to do with when we can get testing up to a sufficient level that we feel like we're getting an accurate cross-sectional look at what's happening in the population. And from there, you could make judgments about changes in that. At this point, I think we don't think we're testing broadly enough to have a great view across the whole population, but that is coming soon. And once you have that, I think you can make trend judgments like you're talking about for when things may change in one direction or another.
And how many inmates were in contact with the healthcare worker who tested positive? And do you expect the test to be conducted by the end of the week, by early next week? Is there a timetable for that?
We're in the process now. It may start any day, again, coordinating with AU and the National Guard. So we're on their timetable, but we were in contact with them as early as this morning, that they're still trying to put it together. So we expect it to happen within the next week to the process begin. But we're talking about between 100 and 150 inmates that may have had direct contact because this dealt with the dispense of medication. So those are the ones that we're testing. Of course, we don't have the capacity to test 1,000 inmates. That's why we're moving forward with precautionary steps of adding the mask and, again, testing all our medical staff and workers at the jail to make sure we have contained or at least controlled or isolated any potential positive cases. So hopefully we'll start that between now, within the next week, we should be up and running on those tests.
So, yeah, my follow-up was, what happens if, God forbid, one of those inmates does come back with a
Well, that has always been our greatest fear. We've had that contingency in place since it started, so we do have a contingency in place for isolation of inmates. But as you know, in a facility, I got 1,000 inmates. If 100 came back positive, that would be a nightmare scenario for us. We can't isolate 1,000 individuals. So that's why we think it's important and prudent for us now to get ahead of this and test as many as we can to make sure we don't bring in those infections. So we do have a number in which we have isolated out that we think we can handle with care and ease based on our facility. But that is why we've been doing the precautionary. That's why we sanitize 5 times a day. That's why we go through the protocols that we put in place 3 weeks ago. And they've been working. And like I said before, even on an operational standpoint, we have been, and I use the word fortunate, but I dare say we've been blessed in Richmond County with the amount of calls that we do and the call volume and the amount of inmates that we have. To have so few cases is extraordinary. And we liken that to the fact that we have been taking those precautions, even in this building, sanitation methods and whatnot. And like the chief was saying, the mayor was saying, this has been a government effort, a group, even for central services, providing us with extra sanitary for this building, because my employees are coming in where other buildings may be closed, they move those resources to this building. So we're doing all these things to help mitigate. But that is the nightmare scenario. That is when we first started, that we talked about as sheriffs, in the sheriff's office, that was going to be his nightmare scenario. And not just for the COVID-19, but any airborne virus that hits your facility, you have to have a contingency. Now, we have a contingency in place. So hopefully we don't get to that point. And we're doing everything that we possibly can that we feel that we should be okay.
What if that nightmare situation happens? Are you guys going to the court system to ask judges to consider nonviolent offenders be released?
Well, that is always an option. That has always had the conversation. But then you're looking at it to the fact of you want to take an infected person, just release them back into society and custody. That's a fix from a jail. That's not a fix for Richmond County. So we have to look at it from a holistic standpoint. Now, in any case, we've always had the option of going to the courts and saying we need a reduction of our jail force. That's one of the things that we talked about in the upcoming splash, that in the jail expansion, because we have a high number of jail population right now. That is something, before this virus comes, the conversation has been had a year ago about expanding our facility. So these talks are not anything new. So all these contingencies that we're talking about, these scenarios, we've already had those discussions. So we're not there yet, but that is an option. Another option, of course, is some of the medical facilities throughout the state of Georgia. We've been in contact with those. And then again, but we do have a buffer where we do get cases that hopefully we can isolate those cases, ride out the 15 to 20 days or whatever it's spread, the incubation period happens, that we feel comfortable, and then we can get through it. Because just like anyone else, we feel that most individuals who get it will recover if there's no complications. So if we do get infected, we will isolate, hopefully they get through and they'll recover. Just like I said, I had a deputy who got infected. He was out 21 days, came back to work cleared, and he had very mild symptoms, but he was out for 21 days. So we're going to follow the same protocol from that point, but all options are on the table, but we're not at that one yet.
All right. Again, we want to thank you for coming. Our residents, all of you Augustans that are out there, please follow these guidelines that we've shared with you today as we move to Friday with the opening of those facilities. And we look forward to coming back on next week sharing additional information as we get it. Thank you.